There. Welcome everybody to this webinar entitled How to Write a Winner Paper. As part of my compromise as president of the EPOS, here is the first tool to help you to be successful on your presentation to the annual meeting. We all know that you have very successful works and heavy works, but sometimes they're unable to reach the podium. So there's many times little details that makes these papers to fail. The intention of this webinar is to give you an overview of what the reviewers look for, what are the things that they value on a paper, and what are the mistakes to avoid. We know that, as you all are aware, that in 2 years' time, we're going to have a combined meeting between EPOS and POSNA, and POSNA in Washington. So we thought it would be interesting to have a wider perspective. So that's why we're only not going to have a view from the EPOS corner, but we're also going to have a perspective much wider. And I have to welcome and especially thank those people from POSNA and from Australasia that have offered their help to help us to understand what it has to be judged in the paper. On the second part of the meeting, we will have with us a few of the most consistent and most successful presenters in our meeting between our members. And they will explain us how they prepared their papers and what are their tricks and hints to be successful on the presentation. So I hope that this webinar gives you some hints, and I will encourage you to put your work for our next annual meeting, and I'm sure that you will be successful. And having said that, I just want to give the word to Ilkka Elenius that's going to introduce the first panel. Thank you very much.
Thank you very much, our President Ignacio, for your introduction. And my name is Ilkka Elenius, and I'm going to introduce our first session. And I'm inviting you to send questions during the session, and then we can continue the discussion. So the first session will be geographical considerations, and I'm very pleased to introduce our session 1, which includes the EPOS perspective by Mr. Andreas Ropos, the POSNA perspective given by Professor Mike Millis, and then the far side contribution by Dr. Peter Kandi. With this short introduction, I'm very happy to give over to Mr. Andreas Ropos to tell his tips and tricks how to write a winning abstract. Thank you very much, and please, Andreas.
Thank you. I'm just going to share my slides if I get the link.
Professor Helenius, you have to stop your screen sharing, please.
Okay, so thank you so much for the opportunity to talk here. I hope that you can see my slides. Is this visible? Yes?
Yes, we can see.
Excellent. So how to prepare a winner paper? I thought actually first of all, you need to get nominated for the Best Paper Award, and the nomination is based entirely on your abstract and nothing else than your abstract. So this shall be the focus on my presentation here. I'd like to briefly talk about the difference of a conference abstract from a journal abstract and what there is to consider. Then I'd like to talk about the domains of a good conference paper, so abstract as well as a presentation. And I will give you a few guidance in terms of composing an abstract. So a conference paper is always submitted alone, and there is no enclosed manuscript. So if something is unclear, whoever is going to read your abstract, they will not be able to turn to a manuscript for looking for more information. So there's therefore a higher risk that you get rejected or you get graded rather lowly. The other thing is that a journal editor might like your paper, but it doesn't like the abstract and will still accept the paper. However, if the conference abstract is poor, there is no time, there is no opportunity for any improvements to be made on your side. So therefore, the conference abstract has a selling point of a particular kind that you need to be aware of and consider. When we think of domains for a winner paper, we want to talk about or think about a topic of the research. We want to be sure that the topic is of wide enough interest and perhaps, is ideally covering something that has remained unresolved for a rather long time, and it offers something new. Within the topic, we need to find the research question. So will your peer surgeons rate your question? Is it important and important enough? The quality of the work should be referred to the so-called levels of evidence in terms of how you design your study. There's loads of guidance on it. Then, of course, the composition of the abstract. Here, I think focus is the key. So if you go a bit into the topic is always within pediatric orthopedics, and it's important that you know your area very well of the research that you're going to do, you want to present, and you tackle so-called gaps in knowledge. For example, this could be something that was discussed in the previous conference a year ago or 2 years ago, and you pick up on it. You may ask content experts if your idea is very good or if it is just interesting. And you will then decide whether you want to pursue it. You want to make sure that your interest matches what people think is lack of an important knowledge. And if this test if this doesn't stand this test, then you may not pursue with your interest. And there's also this issue of creating new knowledge versus a confirmative but better designed studies. Within the topic, you choose your research question, and good questions are always relevant. So they lead to a change in clinical care, they stimulate new research. They are manageable in terms of the research and your own academic abilities. They have an original dimension to it. They're usually clear and simple, ideally. And they're interesting to the wider field of pediatric orthopedics, not only to the very content expert. The quality of the work, you may refer to the EPOS levels of evidence, which can be found on the web link above. But in essence, you want to talk about and concentrate on your patients of interest. You always want to say what your intervention of the research is or was. So this could be treatment or could be an exposure. You always must have a comparison group. It's never good not to have a comparison group. Your outcome should always include something that is patient reported and long enough follow-up times. And you should always report a magnitude of effect, like a risk ratio, a confidence interval, and always perhaps also make sure that your study is adequately powered. And finally, the composition of the abstract. So why is it important? The abstract will lead to the nomination of the paper, as I said before, and the presentation actually follows the abstract in terms of structure as well as content. So in my view, in essence, it is the bulk of your presentation, really. The premise is writing a good summary of your work that says it all. And reading it alone should lead to a high mark, ideally instantly. So it has to be something that is easy to read. Because there's a work limit, you must select facts among many facts. And there's always the risk that you miss important facts, you select the wrong ones, or that facts are going under if too much is presented and if there's too much unnecessary information. There's also the risk that it could look a bit hastily written. So if the ductus is not logic, if there is no logic sequence, if there's a lack of focus. So things that are hard to read are always difficult to move forward. And a test perhaps would be giving the abstract to a few readers and see whether they grasp it instantly. The structure and what to capture. So the title, of course, reveals the key facts, what the study did and what it found. Or it highlights a strength or anything exceptional. So for example, if this was a prospective study, then it's worth noticing, or if this was like, a very large population-based study, because it shows, the strength of your work. And ideally, you should choose, in my view, a declarative phrase or a research question, so that the title already tells the reader what to expect. The purpose, usually one sentence and not more. Should include the patients, the intervention, the comparator, and perhaps also an outcome. And if there is also a background section, one sentence about the gap in knowledge, but not much more. The method section typically is half or 2/3 of the entire abstract. You talk about the study population, your measurements, your comparison group, and the statistics for the outcomes. Results, 2 or 3 sentences, and conclusion, 1 or 2 sentences. So this is how it should look like. To the left, the bulk actually of this percentage in the sections is the methods. What is less good is if methods and results is equal, or if results is even more, because then it's very hard to sort through the results, and it is left to the reader to decide what facts are most relevant. And in the purpose, there is no room for any information that is widely known. So no one needs to say things like DDH is regarded an important disease. Everyone knows that. And my final slide, the composition of the abstract, the topic. Important is that you remember that pediatric orthopedic surgeon will mark your abstract and not necessarily content expert. So make sure that the topic is something that speaks to a wider audience. Decide on a very clear message. Write for your audience. Use acronyms when you talk about things that everyone understands. Assume some sort of background knowledge. Don't write the obvious. Always use active over passive voice. Never write in the future, past or present tense. And think about the abstract grader. So make your piece outstanding. It should be compelling, maybe provocative. Easy to read is utterly important. And there should be some brevity. Thank you so much for your attention. Oh. Oh, don't say this.
Good morning. It's my pleasure to take part in this webinar. Very interesting opportunity to share some of my thoughts over a long period of time.
Professor Milius, I'm sorry to interrupt. Unfortunately, we don't see your video camera. Would you mind putting it on?
Let me see. Show. How's this?
Excellent, thank you. Please go ahead.
My apologies. It's a pleasure to participate in this webinar and to follow Andreas, who's given us excellent ways to do a winner paper for EPOS 2023. My perspective will be a little bit different, and I think it's going to be fun for you all to see our different perspectives. So I'll disclose that I don't speak for POSNA, even though I am a POSNA and EPOS member. I am still learning how to write papers. The process is difficult for me, and indeed 10 minutes of tips are only the tip of the iceberg. So I'm dropping back, before you're writing the abstract, to how we do good studies. I'll admit that I'm a hippology zealot, and I'm an admirer of the Iowa orthopedic tradition that had a deep interest in the natural history of patient outcomes and so on. And I've been blessed, really, to have a career-long single-site practice to allow continuity. So maybe I have face validity to discuss at least hip dysplasia, And indeed, most of my, I think, very important papers have involved hip dysplasia. And I'll say from the outset, I'm very lucky to have decades of patience to teach me. So I'm going to rely on others for some of the tips I'm going to give you. And one of my most important teachers is Atul Gawande, a very interesting surgeon and author based in Boston. In his interesting book called Better, which is a surgeon's notes on performance, he had these suggestions for becoming what he calls a positive deviant. And Atul suggests we ask unscripted questions, don't complain, count something. Obviously, that means collect data, write something, make sense of your data, and indeed change. And hopefully we all change as we learn. Good studies start with good ideas. And for me, a key concept is ask questions, be thinking all the time about questions that you have and that others give you to seek ever better answers. So when we ask ourselves how we create good papers, and these guides are not going to help you so much get the abstract ready in the next few weeks, but build a foundation for beyond. I think that I've learned that collaborating and interacting with different, diverse colleagues is critically important. Our patients may be our most valuable colleagues and collaborators. And I'd suggest we each sometimes try to be like a child, be open to new ideas and share them. And this relates to getting honest feedback early and continually, and it's very important in all we do. We're all going to stress how important it is to develop answerable research questions, and this step is not easy. So you'd like to design studies to answer your research question, do the study, be prepared for real-world compromises, and be humble but persistent, and Christina's going to talk about this later. We can discuss the anatomy and physiology of clinical research. And I've read several good books. Among the best I've read is this one called Designing Clinical Research. The anatomy of clinical research consists of the good research question. And the physiology consists of good study design. And Andreas has already discussed that. In real life studies, doing the work is what you have to do. And it's critically important to have passion and interest in the topic. And this is really important. Developing the research questions, this is absolutely critical, and nobody has time enough today to go into the details too much, but this is a very important skill to master, and it takes years to master that. What makes a good research question? Well, this is saying what Andreas said in a slightly different way, a little different algorithm here. In this Designing Clinical Research book, they broke it down into this finer algorithm. A good research question, a good study is feasible, interesting, novel, ethical, and relevant. What are the pitfalls in doing studies and writing papers? There are many, of course. First of all, choosing projects for which you're not enthusiastic. And I would suggest that teams get these projects done. Teams get papers written. Someone on the team should have enthusiasm. Suboptimal teams, that's real world, but we ought to do the best we can to get teams working optimally together. Another pitfall is not getting and responding to adequate early and continuing feedback. Having a lack of clear answerable research questions, it gets back to that over and over again. And lack of statistical input early on. These are all things to avoid. In summary, there are certain pearls for doing good academic work. I'd suggest to you that there are questions that arise every day. Try to keep track of them somehow. So many questions, good ideas come and go. Some of my best seem to come when I'm in the shower. It's a hassle, but I try to keep track of them. Encourage questions from everyone. And I've learned that they come especially from patients and families. They often have pointed me to good projects and studies. And read and listen more than you speak. Each of us has the opportunity to both be a mentor and have mentors, and I think we should take advantage both ways. So these, I would propose to you, are among our most important collaborators and colleagues. Use them well. Thank you very much.
Professor Millis, would you mind stop your screen sharing, please?
All right. Shall I make a start?
Yes, please go ahead.
Okay, thank you. Well, thank you very much for inviting me to talk. And it's the middle of the night here in Australia, but we'll see how we go. There are two things that I want to talk to you about, and one is abstract Zen, and the other is PowerPoint Zen. And I'll spend a little bit more time on how to present well on your PowerPoint. The reason that I was perhaps asked to present was that this year in Copenhagen, I won the best clinical science paper. And I think partly that's because I wrote a good abstract, but I did follow it up with what I thought was a good presentation. When you're writing your abstract, as both Andreas emphasized and also Mike alluded to, is that I would encourage you to look at a prospective and a controlled study. I think all too often we see some very nice research, but there's no control group for comparison, or your control group is some retrospective data. Now, the issue with doing a prospective paper with a control group is that you've got to put in the time to prepare it, and that can take some years. But without that, I don't think you're really doing yourself any favors, and I'd encourage you to try and look at a 3 to 5 year study to get some good results. The second point, as I've mentioned there, is about a common condition. And some of my first work was on forearm fractures, and I was staggered to learn, and when I reviewed the literature, how few studies there were of forearm fractures, and in particular those done in any prospective manner or with any control groups. And the advantage of looking at a common condition is it doesn't take very long to get good numbers. And if you want good science, you need good numbers. So I'd encourage you to look at some of the things that you treat commonly and study them. Work out some different way of treating them. Perhaps one of your colleagues treats things in a certain way and you do it in a different way. Why not put them together in a prospective way and study to see who's the best? When it comes to your presentation, it's very important to have just a simple message, to talk and point to your slides, and thirdly, to speak slowly and clearly. Now, on that third point, I'll show you where I am down here in Adelaide, Australia. And most years I come to EPOS, usually in some beautiful part of Europe. And the big attraction for me, apart from the travel, is to interact with a lot of different people from different countries. And I pick up some wonderful ideas, some different concepts, things that are treated differently to what I treat them, but end up with equal or sometimes better results. One of the hazards, of course, is that you all speak different languages as your first language, and the EPOS meetings are in English, and even the funny English that we Australians speak. So when you're doing your presentation, you need to speak slowly and clearly so the person in Poland or France or Turkey can understand what you're saying. So you'll have to slow down your speech and practice it, preferably with someone who has English as their first language, to make sure that your words are understandable. So as others have said, it's important to start with a good study. Try and make it prospective and with a control group. When it comes to your actual construction of your PowerPoint presentation, use only 2 or 3 points per slide. It's very tempting to put too much information in. And as Andreas told you, make your abstract punchy, so also make your PowerPoint presentation punchy with not too much information. If you are having images or photographs or x-rays, have only 1 or at most 2 images per slide. Now, what I'll show you is the title slide from my presentation. It had 3 things. It had the title, the authors, and where I'm from. Just 3 things. That's all you need. Now, my second slide, after a declaration of interest, was to tell the audience what I was studying. I had words saying that we all know that serum metal iron levels are increased after metal-on-metal hip replacement. And I had a photograph of a metal-on-metal hip replacement. Below that, I had said that metal ions are also seen in pediatric spine patients. And I had a photograph of someone having a pediatric spine operation. So the words on the slide matched the image. Don't mix them up. Don't have a photograph which is not relevant to the words. If you have a slide with a graph, you must walk the audience through the graph. You must point out what the x-axis means and what the y-axis means. And do point. Most times on the podium, you'll have a mouse and a cursor, and you can point. So this was the slide with the only graph that I showed. And I introduced the slide, and I told the audience I was talking about titanium levels. And I said, here is the x-axis with the time, with measurements pre-op, post-op, 24 hours, 7 days, 30 days, 6 months, 12 months, and 2 years. I then said, on the y-axis is the metal iron level in parts per billion, from 0 to 3. I then said, now all look at the blue line. The blue line is the titanium levels. And as you can see, by 24 hours, it's starting to go up. It peaks out at 30 days and remains fairly static out to 2 years. I then said, now look at the red line. That peaks at about 30 days and then slowly declines down to close to baseline by 2 years, but not achieving baseline. I then went through the purple and the green lines. So I walked the audience through it. Now, the reason I did that was partly because this was the main focus of my whole paper, was to understand that graph. I edited out lots of other slides. And when you're reviewing your paper, your PowerPoint presentation, look at each slide and say, should it be there? Does it have a message? If it doesn't, leave it out. You want to spend time with each slide. And the reason you should do that is that sometimes the audience may be tempted to look at their smartphone to check the message from the office about some patient or to check what's happening in the world. And sometimes they'll just look up from their smartphone, and if it's a complicated slide with lots of words and there are lots of slides, you're going to lose them. So you must capture the audience. You must hold their attention. So you've got to be a little bit of a showman to demonstrate what you're talking about and hold their attention. So what I did, I showed this graph slide not once, not twice, but 3 times I showed the same slide. So show the important slide at least twice. It improves their recall and helps them to understand what you're talking about. There's probably only 1 or 2 important messages in your presentation, similar to your abstract, as Andreas told you. Make the important points. Make it stand out that this is something worthwhile. So emphasize that point in your presentation. Sometimes you'll be quoting someone else's work, and I think this is a good way to present it, to do a screenshot of the paper. Include the reference, because some people in the audience may scribble down that reference so they can read it themselves later on. And at the bottom, I tend to provide a little summary of the paper. So in this case, there was evidence that titanium is transferred across the placenta to the fetus. So give the simple message down the bottom and show what the paper is. But only show 1 paper, don't show 10, because they'll try and look at all of them and they'll lose the attention of what you're trying to say. So when you're up there on the podium, as you're stepping up there, remind yourself to speak slowly and clearly. And sometimes what I do is I imagine that I'm not talking to Frank Ackerblad or Ilka or Mike Millis. I'll imagine that I'm talking to some first-year medical students. And I'll explain things in a very simple language so they'll understand it. And that's really important, I think, when you're talking to an audience which is as diverse as the audience is at EPOS, is that you must make your talk understandable. Try not to read your talk. Know your talk well enough that you can talk to your slides, that your slides are the prompt for what you're going to say. It comes out much more conversational, and if someone just reads word after word, it does lose the attention of the audience. And the other nice thing about giving a paper is you don't need to justify what you're saying. It's not a detailed manuscript. It's just talking about your abstract. So you don't need to justify your methods quite so much. You've really got to talk to your results. You will mention your methods, but you'll mainly talk about your results and conclusions when you're giving your talk. So in summary, try and make your paper prospective or controlled. Make your slides simple, 1 or 2 points per slide. Talk and point to your slides when you're giving your talk. And above all else, speak slowly and clearly. Thank you very much.
Thank you very much. Very good 3 presentations we have just heard. And I'd like to ask all the panelists to join and open their video cameras. So we have already questions coming in, and I'd like to actually deliver to all 3 of you this very good question from the chat. So what are your thoughts about the impact of level of evidence to the final decision of the reviewers to become a winning paper? So if we take that the randomized clinical trial is like level 1 evidence, prospective level 2, large retrospective level 3. What are your thoughts? Should it affect strongly on the selection of the best papers? And we could go through this question and answers in a similar fashion than the presentation. So if you, Andreas, could please address first this question from your point of view. Thank you.
Sure. Maybe I speak for EPOS and Dr. Millis can talk for POSNA. But normally the level of evidence is nowadays required when the abstract is being submitted. And of course, reviewers are going to look at it. The difficulty often is that authors try to upgrade their studies and give them a higher level than there actually is. But typically the reviewers can spot this. It goes to what Dr. Peter Kandi has said, that you should always strive to have high quality studies. And high quality studies are more likely to be selected for acceptance or for a award paper. So it does matter. And most of the time, the author is required to specify the level.
I would agree with Andreas. On the other hand, you have data, and it's not always the kind of data you would like. And I think that good studies can be done on imperfect information. The real world is not perfect. And so I think the reviewers are willing to look at any well-done study, even if the level of evidence is not the highest. So I would not submit a study or do a study just because you do not have it, you do not have perfect evidence.
Yeah, I do agree. I do entirely agree.
And is Dr. Kandi still available to answer this question?
Yeah, I'm here. I think it's nice to see fresh and new ideas, and I personally am not a big fan of meta-analysis for podium presentations. I think it's nice to see fresh research and new things. And I think one of the issues with meta-analysis is that often the studies that you're meta-analyzing are all quite variable. We make attempts to make them comparable, but I think that's one of the challenges. So I'd perhaps got a preference for new, good prospective studies.
Thank you very much. So in conclusion, we need all kinds of studies, and each type of level of evidence may lead to a winning paper. Maybe I continue with the same topic and ask, should we do more randomized clinical trials, or is randomized clinical trial typically with too strict inclusion criteria not very suitable in the pediatric orthopedic point of view? And if we try to answer this question in a similar fashion, going through the panelists, please.
Should I go first then again? I think, yes, we should be doing more high-level evidence studies. I would be a bit provocative and say we no longer need any case series. So this would be a level of evidence number 4 with no comparison group, retrospective, where it's very hard to ascertain the validity of the work. It's getting harder and harder though, because I think the low-hanging fruit has been picked, and we now need to actually, make more efforts in clinical research to establish new evidence. Not everything has to be randomized. There's a very good, prospective cohort designs. Not everything needs to be randomized. So if you look into a study on prognosis, or if you look into something that is very strong cross-sectional, then of course, it's equally good. But yes, people should be encouraged to do more randomized work.
I agree, Andreas. I think that another point is that even if you can't randomize, you can collect data carefully. And I've been lucky. I've practiced at the same institution for more than 40 years. but each should do his best to make the patients understand how important it is for them to stay in touch. And we should all do our very best to hang on to our patients. And as we retire, make sure that the patients have a tradition of staying in touch with the institution. And this is the best way for us to get information without doing necessarily randomized studies. There's so much information that is lost every year, not because we didn't randomize, but simply because we have lost our patients.
Mm.
Yes, I agree. I think a couple of issues. One is that sometimes we rely upon fellows to do our research, and often they're with us for a year and then move on, and it's quite difficult to do some high quality research in a year. So sometimes you've got to spread the project over several years, which is a challenge, I think. And the second point is that the design of the study's has got to be good, I think, and you've got to make sure you know just what question you're asking. Ideally, you will have some sort of control group and not just one way you treat it and it all looks good. I think you've got to avoid that. So I think it's ripe for us to do this. I think we need to do it. I think we need to record what we're doing, as Mike Miller said, but we're often quite good at recording our operations. And my experience has been we've not been very good at recording the patients that we see in the clinic or in outpatients. And I think that probably is an area which is ripe for doing that. I think in the US they do that very, very well because it's hooked into your billing services, Mark, I think. And but I think for other parts of the world, we're not very good at recording the conditions which we don't treat with operations. And I think that's an area where there's a great scope to do more of what we treat and see in outpatients in the clinic. Thank you.
Thank you very much for good answers. So we need also long-term studies. We need also natural history studies. We need, again, all kinds of good studies with good control groups as well. So maybe the last question for all three of you would then be, if you would try to pick up what is the major difference when you are writing an abstract to an annual meeting as compared with an abstract which is part of your manuscript to be submitted into a journal. Thank you.
I go first again. Well, as I tried to say in my talk, I think the issue is there's one shot to get it right. And allows the abstract for a manuscript can be rewritten. If someone reads the paper and they say your abstract is poorly written, rewrite it. And that chance you don't get for a conference. I think anything else is the same. Perhaps, trial it more, give it to people for readability, tweak it, make it as short as possible, as concise as possible, and perhaps, be provocative so that there's something outstanding there.
I agree, Andreas. Ilka, I see another question on the chat that asks about what our opinion is on qualitative studies in pediatric orthopedics. May I switch just a bit and answer that question?
Please go ahead.
I've had wonderful collaborations with my patients, and I think we all have. But I've tried these last few years to put myself in the patient's place and do interviews and really try to understand their perspectives. And this is not so quantitative, this research, but the qualitative aspect is, I think, equally important, though not so well practiced and not so familiar to us. But as I'm relearning and picking up new skills, I would present this as very important, not just in pediatric orthopedics, but across orthopedics in general. So I've really enjoyed my qualitative work I've been doing, and you'll be seeing more and more of this, I think, in the literature and at our meetings going forward.
No, I agree entirely with all these comments. I think the thing we perhaps don't traditionally measure well is the PROMs, the patient satisfaction. We probably measure function sometimes, but all too often we measure X-ray results, which don't always equate to better quality of function for the patient. So I think increasingly we have to include those aspects of it all. And somehow we need to include some measure of complications. And if you've got, say, 2 operations and they seem to produce about the same results, but you've got a complication rate of 5% with one procedure and a complication rate of 30% on the other one, how do you scale that up or down to make your results meaningful? And we've been measuring the X-ray results, but if the complication rate is higher, should that scale your results down by 10% or 20%? Because some of the complications can be catastrophic. So if you get a catastrophic complication, then that needs to be scaled up. And I think the Clavian-Dindo sync method does give us some handle on that. So I think it's really important to have some system for measuring your complications and perhaps emphasize those a bit more in your results. Thank you.
Thank you very much for all 3 of you joining the session 1 on geographical considerations. I think we used pretty much our time for the first session. I thank you once again, all 3 participating, and also the audience for sending us questions. And I will hand over to Dr. David Farrington, who will chair the session number 2, personal considerations. Please.
Hello, good afternoon, everybody. Thank you for attending this webinar. In the second half of the presentations, we're going to have a personal view of the different actors that play a role in the award assignment for papers, in the preparation of these papers. And we're going to start this second half with Federico Canavese. There's been a slight change in the program. Professor Canavese had to leave a little bit early, so we brought up his presentation. Federico has participated in many EPOS meetings with different papers, and he's also been awarded in several times with winning papers. So it'll be very interesting to listen to his tips and tricks on how to make a good presentation and a good abstract that can be in the selected for awards. Thank you very much, Federico.
So good evening. Thank you very much, David, and thank you very much, EPOS, for inviting me to join this webinar. So I'm going to share with you some of my thoughts about writing an abstract. And most importantly, the first thing it comes to my mind is that writing an abstract is like doing sport. You can only do better with training. So it takes time to to improve your writing skills. And the other point is just that I want to highlight is a sort of try to explain you what are the points that comes to my mind when I write an abstract and what are the aiming in my practice to write the abstract. So really for me to get better, the question that always drove my writing of abstract and scientific papers was to understand why I was doing so. And then the other part of my talk would be about the timing of writing an abstract, when to write it, and what is important is an abstract, and I will share with you some example to end up with my personal checklist that you can use if you wish. So when I write an abstract, what I want to do is to write a short summary. Usually is between 100 and 300 words, but this is very variable from one meeting to another, from one journal to another. But really what is important for me is the second point, that in my abstracts, I try to put on only unpublished data. It means that this is the reason, one of the reasons why I'm writing the abstract. We will see it later. I write it because I want to share with the pediatric orthopedics community some new data and get some free feedback from the community to improve my paper at the end. And then what is important is that the abstract, when I make it, I want to have it extremely clear, or as clear as possible, so that the reader can understand my research, can understand the topic I'm talking about without reading the full paper. So for who I do write the abstract and why, I'm telling you, is to expose the results with people that share the same interest, to help potential readers to really understand if your paper, your abstract is going to be relevant for their own research. But really the main reason why I want to go to EPOS and present my abstract to the EPOS community is really to stimulate questions from the audience that can make my research or the analysis of my research better. So really I wanted to have the paper accepted, to get a feedback, positive or negative, it doesn't matter, but I want to have this feedback back, because my goal is not to have the abstract done, my goal is to have the published paper. I want to publish the paper, and the first step is going to be to write the abstract. However, remember that the temptation, of course, is to write the abstract as a first thing. However, the reason tells you that you have to write it only once you have drafted your full paper, because the abstract is the summary of your research. Of course, you have to write the summary after you have done the research, because you have to know what you are talking about, and most importantly, what you are summarizing. And then the other point that you have to keep in mind, and that I keep in mind as much as possible, is that people, the reviewers that are checking your abstract, they cannot read your mind, they can only read your abstract. So your words have to be clear, you don't have any ambiguity, and you have to avoid any kind of inconsistency. Remember, the reviewers judge your paper on the basis of what they read. So this is essential. And also, you have to think that when you write an abstract, you have to use scientific language, because a scientific abstract is not a novel. So you have to be consistent with your wording and try to be as much as synthetic as possible. So here are some examples of my abstract. So if I can join the question that was just discussed before, for me, there is no difference between the abstract I'm going to submit to the meeting and the abstract I'm going to submit to the journal. The abstract for me is the same. It has to be equally good. If it's good for the meeting, it will be good for my journal article, and vice versa. So the abstract starts from the title. The title for me has to be appealing and has to be and it's very important because it keeps the attention of the reader. It can be a title that is slightly long and put under a question format like the one that you can see here, and you put the question. This is the main research question you are trying to address, and then you complete the question with some information, some technical information about the study itself. And of course, then you develop your abstract. As it has been said before, I'm not going to go through all these issues again, but I just want to insist in one point, in that when you discuss your conclusion, these must be based on your results. In your conclusion, you cannot come up with new consideration or new data. The conclusion must be linked to your results. But here is another example. Again, you can see that the previous title was 4 lines, and here with the second title, with the 16 words, I was able to provide the reader all the information about the study, about the kind of scoliosis, in this example, thoracogenic scoliosis, the nature of the study, this was a retrospective review, the number of patients included, 129, and the follow-up of this group of patients. So the title can still be short and provide essential information. But remember that the conclusion must always be linked with your results. And then a few hints about the methods and the results that, in my opinion, are the key section of the abstract. So in methods, you don't want and you don't need to evaluate validity on obstacles, and your goal is not to discuss the strength of the weaknesses of your methodology. What you want to give the reader is a quick insight into the overall approach and procedure you used to come to your results and your conclusion. So as you can see here, in these methods, you have to put what your study is about: retrospective review of prospectively enrolled children, follow-up for at least 1 year, 2 groups of patients according to the type of treatment, and then we assess the demographic characteristics, and we did radiographs, and then we assess clinical outcomes. So all this information must be clearly explained. And then it comes the results. So depending on the nature of the study, your results can be very different, but cannot be too long. So here is an example of a radiological study I did. You cannot put all the results into the results section of an abstract, because otherwise your paper is going to be too long. So you need have to highlight the most important findings so that the reader, again, I insist, he can understand your conclusion. And remember, the conclusion has to be linked to the results. So all complex table, all definitive data, these data don't have to go into the abstract. They can be given in the oral presentation, or they can be given in the full article. So really, in the abstract, you need to use only the important points. And then when you write an abstract, we have seen we have different sections: introduction, methods, result, and conclusion. And so should you use the present or the past? So this is my rule. Present, past, present. It means when I explain the purpose of the study, I use the present, as you can see and as you can read here. When I go to the background, I use the simple past. Method and results, I use the past. And again, when I explain the significance of the study, I used the present. And I never use the future because you did a study some time ago and you are presenting the results now. So the expression right, like this study will present, will discuss, have to be avoided, has to be avoided. And here comes my personal checklist before I end up. So you have to make sure your abstract follow the conference requirements or the journal requirements. You respect the word count. You really need to state clearly your research problem and objective and avoid any kind of ambiguity. You have to briefly describe the methodology and give the instruction how to reproduce your research, the main ideas. You want to summarize the most important results, and you write your conclusion based upon your results. You cannot start adding new consideration in the conclusion section of your abstract. You remember that if there are major limitations, you have to mention them, and then you have to write the abstract thinking, as it has been said by Professor Kundi, that the abstract should be understood by someone that has a limited or no knowledge on the topic. And then, because we are no English speaker, make sure that grammar and syntax are okay. So I always have some English speaker checking my abstract to correct my grammar mistakes, because I don't like grammar mistake in my own language. So I can imagine someone judging a paper written in English finding a lot of mistakes. Thank you very much. I forget, I have one more, just a quick few words. Just you have to have a good idea to do your work, of course. Remember to complete the research, and then so you know what you are summarizing. Remember that many times your abstract will get rejected. You will get better with time, and you write the abstract, in my opinion, because you want to have a full paper published. This is the real important thing. Remember to follow a checklist. Don't give up. Rejection is part of the game. And remember that it's like sport, and you will for sure get better with time. Thank you.
Our next presentation is going to be given by Frank Akadbled. Frank Akadbled has participated during many years as the scientific committee chairman, and he's also participated as a member of the reading committee. So he has a lot of knowledge of how is a paper reviewed and what are the main points that a reviewer has to take a look at when he's reviewing these abstracts. Thank you very much, Frank.
Well, thank you very much, David, for the introduction. Good afternoon to everyone. Thank you for attending. Indeed, the purpose of my short lecture is to help you writing a successful abstract and potentially make it an award winner. So a lot have been said already this afternoon with a very clear and complete comprehensive review from Federico. So I just want to humbly share my experience and some tips and tricks. Well, first things first, why am I worth having your attention today? I've been presenting podium papers at EPOS meetings since 2012. I am a member of EPOS Reading Committee since 2016. I've been a chairman of scientific committee and also scientific committee for the French Orthopedic Society. However, I get abstracts rejected every year, so I have no conflict of interest. Maybe the fact that I'm indeed a member of the reading committee represent one conflict. So the purpose of your abstract is to summarize the main points of your research, but also to convince the reviewers that you have something important and valuable to add to their event. This is the shop window of yours and your department as well. So this is something very important which matters. It is also important in an academic career. It adds to your CV. So what is a winner? It has an original or hot topic, this has been said already, with the highest possible level of evidence, with an attractive title, we will get into that, has to be nicely written according to the guidelines, here EPOS, tenses, Federico emphasized this, read enough typos as well, very important in my experience, and the conclusion has to be drawn from your own results only. Title needs to grab the attention of the reviewer, should be clear, short, crisp, to the point. A question can be appropriate and is a good thing. Here I have two examples for the same study of mine, which was accepted and presented last year. 127 case retrospective comparative single center study of resection of calcaneonavicular coalition, clinical outcome of arthroscopic and open approaches versus resection of calcaneonavicular coalition, arthroscopic or open approach. You don't want the first one, do you? Introduction and objectives. You have to state what the problem is and to set the background. Provide clinical relevance. This is very important for basic and experimental research. It's the review. As a reviewer, I like to keep one foot on the ground. So, what is the clinical relevance, or at least perspective? For methods, use the past tense. Be concise. Indeed, the purpose of the description of the method section is not for the reader to be able to redo your study. This is applicable only for the full text papers. This is only to include the most important elements. Is it prospective, retrospective, how many cases, how did you evaluate the results, etc. You don't have to get into details. That's pretty much the same for the results section. Use the past tense, remain consistent, don't switch to past, to future, back to the present. This is not something the reviewer like, or at least I don't like it. Remain concise, you only cite the most important findings. Conclusions, like I said, only drawn from your own work, don't speculate. Yes, you can open some perspectives, for example, future research or change of your practice. Write your paper with a fresh mind, then polish it off. What I mean here is you shouldn't start writing your abstract 2 hours before deadline. You won't make yourself a favor and your paper is likely to be rejected. Write, then step away. Maybe a couple of days, then read again and be critical. You can pass it on to your colleagues. I like the idea of Peter Candy to involve the medical student. They can give you some interesting insight of your paper. Personally, I like to have my wife. She's a gynecologist and she's my first reviewer. Then you edit according to EPOS guidelines, obviously. English language, you can have this reviewed by a native speaker if you aren't, and please don't leave typos. I hate that. And also you can seek inspiration from successful abstracts of past years with the best of the best session and awardees of the best papers, for example, the one from Peter Candy about metal ions. Get inspiration from them. Now the key points. Title, very important. You should allow time and efforts that your work deserves. Don't wait until deadline to start writing. Have your paper reviewed by colleagues, if possible, experienced ones, and you have to love your work. Thank you very much for your attention.
Thank you very much, Frank. We will have our last presentation of this second half, and Cristina Alves from EPOS will give us her presentation. I think Cristina is probably one of the most prolific presenters of papers. Her department presents a very, very big amount of abstracts every year at EPOS, at other meetings. So it'll be interesting to hear her give us some hints and tips on how to present and how to get a lot of scientific information out to the people. Thank you, Cristina.
Oh, thank you, David, and thank you for inviting for this interesting session. And when you first invited me, I, as Frank said, I have many abstracts rejected. In fact, I have many more abstracts rejected than accepted. But I like the idea of not giving up. And one of my heroes in science is Stephen Hawking. I think that he is really our image when we think that we should not give up and we have the responsibility to continue to ask questions and open the door to discovery. Presented my first paper in EPOS in Lisbon, 2009, and it was an abstract from collaborative research about clubfoot with different hospitals in Portugal. And since then, I have submitted many abstracts, have failed many times to have the abstracts in EPOS. And my first goal, in fact, is not to have a winner paper, is to have a paper, because I like the discussion and having new ideas. But just this year, we were lucky and fortunate enough to have our paper, our e-poster awarded as the best e-poster, and that was first author was my junior colleague John Cabral, and that was very nice for us. So it's nice to also aim for the award, although I usually don't do that. We heard about having good ideas and how important is that, but good ideas come from existing things that we think differently or just innovative things. So we don't always have exactly sharp new ideas, but I think for us as surgeons it's also important to understand science and to collaborate with other scientists that may help us to understand better clinical problems and have a critical evaluation. As a resident, I actually did not have much exposure to research, though I loved it. I didn't have dedicated research time, still don't have it. We are mostly rewarded in our careers for our clinical time, our research counts, but and many of us don't have the opportunity to pursue advanced academic degrees that like PhD that will give you another insight into research. But I think more and more we have the opportunity to do collaborative research with other people, and I think that happens when we go to meetings and know different people, when we go to courses, and some good ideas and nice collaborative work comes up. And this is important because you can increase your sample sizes, you can have comparative groups. So it's nice to also work as a team and collaborate and create a network for your clinical and research work. And I like the idea of establishing goals, and we should think about it in our academic clinical life and also put our personal and family life into it and think about timelines, like what do I want to achieve in 1 year, 3 years, or 5 years. And we heard Peter Kunde talking about probably a prospective study will take 5 years for you to put up. Maybe you can do other things in the meantime, but you really have to kind of make a plan and think of what you want to achieve. And underestimation your task demands or overestimating your motivation or overestimating your time may be factors that will interfere with your ability to succeed in research. So wherever things don't involve us, plan, reevaluate, replan, and change. research funding in our reality is almost a no. I don't remember having any funding. EPOS now has research grants, so that's an opportunity for everybody. So how do we get started? We get started with the research question, and we heard about it. It's very important to use your observation power, listen to your patients, listen to your colleagues, know about what is the thing that interests you the most, know the literature, talk to others, attend to meetings, and get a good research question that is feasible in your reality, interesting to you and to others, novel if possible, relevant and ethical. And we talk about the PICOT format, which I think is important to follow. You have to put in your population of study, the intervention of exposure comparison, the outcome of interest, and the time frame and the type of study. And you have different studies that will give you different levels of evidence, and basically you either go the experimental way or the observational way. And we are not very used in pediatric orthopedics to do qualitative studies, but I think they are more and more important for us to understand our patients. The thing we have to keep in mind is that the more complex is the study, the more costly and time-consuming it will be. But when we talk about outcomes, it's interesting for reviewers and for readers and for everybody to go beyond X-rays and get a study where you evaluate patient satisfaction and patient-related outcomes. And then you will have to find the right outcome and know about if it is valid, reliable, if it is responding to change, if you want to measure that. And you can find different outcome measures depending on if you want to evaluate physical functioning or health-related quality of life. All these outcomes are important for scientists, for clinicians, for patients, and for health policymakers. Then someone asked about sample size, and sample size really depends on the outcome measures that you choose. And I would advise to talk to a statistician and use your clinical judgment. Those are very important when choosing your sample size, and you have the opportunity to do that in prospective studies. Then usually reviewers also want to see your p-value, and it's usually under 0.05, but if your study is non-significant, then you want to tell what was the power of your study. And also it's nice to have a notion about what statistical analysis are you using, depending on what kind of outcome are you choosing. So I think it's very important to choose what kind of outcome you want to use in a study, so that you have all your methods defined and your statistical analysis also planned. And it's also important when you talk about human research to do ethics review board, informed consent, if you're working with children, informed consent, and data safety monitoring. So you have to plan very carefully. And then also it's good to give a look to the data when you go to your research, so that you make sure that nothing strange is really coming up. Either it's an outlier or is a mistake when you're introducing the data. And also try to resist to interpret the data before the study is completed, or to analyze it under the study has been closed, and avoid data mining. If you don't find the results you want, then don't look at the data trying to find other results. So it's important to present it. You present a paper. I usually don't write up the paper before presenting it. I start, but I don't finish it. I want to hear the ideas, but I'll go over it. But you have to know that, and everybody's shown that writing an abstract is very important. It's the condensed version of your work, and it's how reviewers judge if your work is worthwhile to know and how also meeting attendants decide whether if they want to go to the session and they want to hear your research. So you want to show why did you start, what did you do, what did you find, and what does it mean. And the abstract, as Federico and Frank told us, should not have any information not contained in the original work, or any lengthy explanations or unexplained acronym or abbreviations. So it's striking that sometimes people will try to submit abstracts without respecting the word count. This is very important. So go to the conference instructions and read the guidelines. And for the English, I also like to have someone who is good in native English to review my abstracts if possible. So EPOS abstracts, Frank and Andreas went over them. Very important to check each year what are the sections. And in my department, we usually present the abstracts before submitting them. So in our division meeting, we read the abstract and everybody criticizes the abstract, and we do the same thing for the presentation. So you have to be humble and open to criticism. And then once you present the paper, you have your presentation at the meeting. Don't forget to write the paper. So we've looked at it once, and the amount of papers presented at EPOS that are then published is about 20%. So you really want into it, because if you just present, then people will not be able to read it and to think about it. And the way I write the paper, I usually start by the methods, then the results, then the introduction, then the discussion, and finally the abstract and title. And I also think it's very important to discuss authorship up front, so that people are not angry and no hidden feelings are jeopardizing your ability to succeed. And it's very important to cite and avoid plagiarism. So, and then when we write it up again, we analyze again, read it, give it to other people, and then write it again, rewrite it, edit, do the proofreading, and submit it. And you have to pick up a journal, or if you want to publish, or a meeting, if you want to present a paper, write clearly, concisely, get an independent review. And sometimes you will aim high, you want to publish in the JBJS, the reviewers don't think it's good enough, so then maybe you have to write it in another format and submit it to another journal. So you may give it a try to 2 or 3 or 4 journals before it's accepted, but do not fear rejection. It happens to all of us. So my advice is persist, persist, persist. Don't give up. And finally, I would like you to keep in mind that the top 5 reasons to reject a paper are inappropriate, incomplete, or insufficiently described statistics, over-interpretation of results, use of inappropriate, suboptimal, or insufficiently described populations or outcome instruments, small biased samples, or text that is poorly written or difficult to follow. So I think that to succeed, we need discipline, resilience, humility, mentorship, collaborators, a team, and ideally, if we can, funding and institutional support. But these not always happen, so I would say that the first are the most important, and researching children is challenging, but certainly they deserve our attention. So this was my message. Thank you for listening, and I'll be pleased to answer questions and invite you to visit our team in Coimbra whenever you want. Thank you.
Thank you very much, Christina. And I would like to invite all the panelists to answer certain questions that have came up. One question that has brought my attention, and Christina mentioned, is the role of mentorship. How important is to have a mentor in getting a good abstract and be able to have a winner abstract? Christina and Frank.
Frank?
Well, it helps. I won't deny it, because the mentor is usually the one who will design the study itself, select the topic, and then that would be very helpful to have the constant support I've talked about reviewing before submitting the abstract. So it sure helps, but it's not mandatory. I mean, you can have an abstract selected and potentially awarded without a big mentor, but you need assistance though. You need others, anyone, to build up, improve after you've written the first draft. So that's my point of view.
Yeah, I agree. I think, and the interesting thing is that at this point of our careers, I think that both all of us are mentors and mentees. So I am a mentor for the junior staff and residents and medical students in our department and people who visit us. And also I have some mentors who will send an email or just say, look at this, is this good enough? Should I change anything? I have this idea, is it appropriate? And maybe they come up with other ideas or with criticism, say, leave it, it's not, you should not waste your time on that, or they just have a different vision that helps. So I think at this point in our careers, we are in both roles, being a mentor and also being a mentee and having mentors. So it's quite interesting. But I think the most important thing is to have someone looking at your work with other pair of eyes and saying, this makes sense, is good, or this does not make sense, or you can improve it in this way or in another way. So a pair of fresh eyes or several pair of fresh eyes will help. And we see that when we do our revisions of papers and abstracts in our department.
Christina and Frank, I know I'm aware both of you have participated in reviewing processes. And you mentioned that language is important, that the grammar and the syntax is okay. We sometimes read an abstract, we know it's a good abstract, but the language, it's hard to read, it's difficult. For non-speaking first language as English presenters, what would your hints be to try to get that abstract into the program?
Well, I kick off again, Christina. Well, that's a good one. I mean, we don't want very elaborate English with very complex. No, this is not the point. But it has to be understandable. And if not, I think this is a problem, and this is part of the decision making. And I think I would probably reject a paper with a very bad English, which I don't understand. But the abstract doesn't have to be very top of the class, elaborate language speaking.
Yeah,
Christina?
I agree. I would say that an abstract that is in very poor English is annoying for the reviewer. So you have like 80 papers to review in 2 or 3 weeks time. I can't remember, but it's a lot of papers, and you continue to be very busy in your clinical and personal life. So you take off time, in my case, usually very early in the morning or late noon. So you're tired. So if a paper comes up with very bad English, then you have these papers I will delay, review, and we'll make a real effort to review. But if the English is good, then it's more easy to review, more easy to understand the concepts. So I'm not an English native speaker. and I think my English is not bad, but I must admit that a small trick I do, and it's not very scientific, but I will write my abstract and we'll put it on Google Translator and see if something weird comes up, so that I make sure that no mistakes are done. And even you have sometimes differences between US English and British English, but that should not be a problem. But at least to make sure that I'm not inventing any new words that reviewers will not understand, you know. And so I'll do that, and I'll ask other people who are good at English to read it. But being a non-English speaker, a bit of problem, but I think we can overcome it.
Well, it's 6:30. I'd like to keep on talking with all of you, but it's time to wrap up. Thank you very, very much for all these tips and tricks. I really hope they're helpful for people that are gonna write and gonna send abstracts. Thanks to Ilka for his moderation. Thanks to Peter, to Andreas, to Michael Millis, Frank, Federico, Christina. I think you've done a great job in a very, very complicated topic, and thank everybody for being there. Thank you very much.
Thank you.